If you have ever experienced an itchy vulva, you are not alone. And before anyone comes to you and say, oh, it's because you don't have good hygiene, you are not taking good care of yourself, you have been sleeping around. No, it's not true. In this video, we'll be talking about why the vulva itch, what could be causing it, what you can do yourself, and when it's time to see a doctor. So, let's talk about the actual causes of vulvar itching. Sometimes, itching can be caused by sexually transmitted infections. With genital herpes, you may notice small, painful, or itchy blisters on the vulva. They are similar to cold sores, just that in a very uncomfortable place. Trichomonas infection can also cause vulvar itching, often alongside an unusual discharge. And remember, if you are diagnosed with one STI, it is important to get a full STI screen. Now, there is also something called pubic lice, sometimes known as crabs. They are tiny insects that live in the pubic hair and feed on blood, causing intense itching, often worse at night. As unpleasant as that sounds, the good news is that they are easily treatable with medications. Not all infections that cause vulvar itching are sexually transmitted. Scabies, which is caused by mites that burrow into the skin, can affect the vulva and cause severe itching, especially at night. Threadworms are particularly found in children, but also they can be found in adults. They migrate from the anal area to the vulva and trigger nighttime itching. Both conditions are treatable, so there is no need to panic. Another very common cause is thrush or a yeast infection. This often comes with intense itching, soreness, and that familiar thick white discharge. Now, of all the causes we mentioned so far, the most common cause of vulvar itch is irritant or contact dermatitis. This is simply eczema of the vulva. It is caused by everyday things like scented soaps, wipes, bubble baths, scented toilet paper, detergents, fabric softeners, condoms, spermicides, and some lubricants. And when itching happens over a long time, the skin can thicken from repeated scratching. This is called lichenification, and it can make symptoms even worse. There are also other skin conditions that can affect the vulva. Psoriasis can appear on the vulva, and on darker skin tones, it may look brown or purple rather than red. Ingrown hairs and folliculitis can cause localized itching and irritation. Conditions like lichen sclerosus, lichen sclerosus, and lichen planus can also cause persistent vulvar itch. These require medical evaluation because some carry a small risk of vulvar cancer. Now, hormones also play a role. The vulva depends on estrogen to stay healthy. When estrogen levels are low or fluctuating, such as during pregnancy, breastfeeding, or menopause, itching and dryness can occur. Also, other medical conditions can contribute as well. Things like diabetes, liver or kidney disease, irritable bowel syndrome, urinary incontinence, blood disorders, and even stress can all trigger or worsen vulvar itching. Now, here is something very important. Scratching makes itching worse. Scratching damages the skin barrier and releases chemicals that increase inflammation. This creates an itch-scratch cycle that is very hard to break. So, what can you do at home to help yourself? First, try not to scratch. I know that this is easier said than done, but if you can't help it, keep your nails shut so that you are less likely to cause damage to the skin barrier. Also, avoid scented products completely. Stop using soap on the vulva. Instead, use a gentle cleanser or plain emollient as a soap substitute. You can keep emollient in the fridge for an additional soothing and cooling effect. You can also switch to gentle detergent for your underwear and avoid fabric softeners. Wear loose, breathable cotton underwear. They are the best. If moisture is irritating your skin, a simple barrier like petroleum jelly can help protect it from irritation. And if itching is disturbing your sleep, a sedating antihistamine at night can sometimes help because it causes drowsiness, which can help improve sleep. Now, occasional vulvar itching is normal, but if the itching is persistent, worsening, or associated with pain, discharge, bleeding, or skin changes, please see your doctor. There is nothing embarrassing about vulvar itching. Delaying care because of shame can do more harm than good instead. If you have questions, please leave them in the comments. I'll be happy to answer them. And if you know someone who needs this video, please share it with them. Thank you for watching. Until next time, stay healthy and be kind to yourself.